My name is Dr. Dave Martini. I'm a board-certified ear, nose, and throat surgeon. The reason I'm here to talk to you is I've done thousands of surgeries in the area of sinuses, sleep, nasal surgery. Throughout the course of my thousands of surgeries and decades of service to the patients, I noticed the problem. The problem is we do not have a good needle to inject local anesthetic. The needles are not strong enough, they bend, they flop around, they do not give a proper safe deposition of anesthetic in a precise fashion. Consequently, it traumatizes the tissue, causes discomfort to the patient. The other problem is they're not the right shape, so the surgeon ends up bending them, or the nurse, and that's a problem with blood-borne disease, either to the surgeon or the patient or the staff. So we have an issue of liability. So to overcome this problem, I've invented a needle called the Numbingbird sinus needle. Numbingbird sinus needle, the Numbingbird sinus needle will, by its design, address these problems. As you will notice, the Numbingbird sinus needle is a very specific length, has a very specific curvature, and very specific portions. This is proportioned to precisely reach the point of injection on the sinuses and the septum when doing nasal surgery. There's also a variation for throat surgery and tongue-based surgery. This outer tube gives the needle strength, so when one is delivering the anesthetic, this directs the tip very precisely to where it must go. There's also a very fine tip which injects the anesthetic agent. It's of large enough diameter to allow an easy flow for the surgeon, but it's also atraumatic to the tissue. A very critical point of this needle is the outer surface, which gives the needle strength. The injection point is fine and delicate and will not traumatize the tissue. And once again, the lumen is of adequate size to allow the anesthetic to freely flow. There's also a scavenger port. This scavenger port picks up blood and other agents that will obstruct the view. The other thing this does is frequently when one's injecting local anesthetic, the anesthetic drips down the patient's throat. It causes discomfort and coughing. This eliminates that by immediately scavenging it. Why is this important? Very critical for patient safety. When one has blood in the surgical field, the rate of complication goes up dramatically. This will also allow more procedures under local anesthetic, which will save money for the health system, save money for the patient, but also result in faster recovery and more comfort. Additionally, in this age of healthcare cost containment, this will allow more procedures to be done on a day-to-day basis, increasing throughput. Naturally, if one has limited resources, it can increase throughput. That's a win for everyone. And equally important, more patient comfort, more patient safety, and it will allow more procedures to be done under local anesthesia. You can, once again, thank you for your time. My name is Dr. Dave Martini. If you'd like to contact us, please look up our address on the web, Numbingbird.com. That's Numbingbird.com. And my name is Dr. Dave Martini. Thank you for your time. At this point, we're raising funds. So any investors that would like to get in the first round of funding, be aware that we have a working prototype. The preliminary patent is granted. We're working on the final utility patent. We have prototypes we need to construct, and that is our progress. Oh, I got one more thing in.
Go.
We've conducted both internet and in-person surveys and questionnaires, as well as online surveys of surgeons, and they find that this will be a product they're interested in, and they are very aware of the cost savings. But interestingly enough, they're interested in this product because of the safety and liability, and also there's no FDA approved needle specifically for sinus or tongue surgery, and this will fill the needs of the concern for liability of not only the doctor but the facility manager, the administrator. So it will serve these functions as well as cost savings for the administrator and the doctor and the facility. So once again, thank you for your time. Dr. Dave Martini, Numbingbird.com.